Hi everyone, my name is Marina Pedanici, and today I'm going to be presenting the Community Assessment of Nassau County, New York. Nassau County is one of the 4 counties that make up Long Island. As you can see on the map, it lies right between Queens and Suffolk County and has an area of 453 square miles, in which 37% is water. It is the wealthiest county in New York State and is made up of 2 cities, 3 towns, 64 incorporated villages, and more than 60 unincorporated hamlets. The total population is 1,358,343 persons, just split about evenly between males and females. As you can see in the graph, majority of the population is white, 13% blacks, 11% Asian, and less than 1% combined of African Indian and Alaskan natives and Native Hawaiian or other Pacific Islanders. 91% of those over the age of 25 have at least a high school degree or equivalent, and 44% have obtained their bachelor's degree. There are approximately 444,136 housing units, 81% of which are owned, and the average household income is $105,744 per year. The unemployment rate is 4%, which is consistent with that of New York State, and the poverty rate is 6%, which is 8% lower than that of New York State. A windshield survey was conducted through parts of Roslyn, Manhasset, and New Hyde Park in order to gather qualitative data and observations. There was heavy traffic in all areas, mainly passenger vehicles, as the major highways lead directly to these areas. The housing units were very close together with limited land and varied in size and style. There were a great number of private housing complexes, especially in Roslyn. When driving, many parks and golf courses lined the main roads and were easily accessible to the public. Almost every road had a Northwell Health building on it or some type of healthcare facility. There was no visible public transportation in the areas that were surveyed, and there were no bike lanes present. Aside from the parks and other recreational areas, there was limited green space, unkempt sidewalks, as shown in the photograph on the top right corner, and it was very noisy due to the high volume of cars and businesses, many of which were retail stores offering both luxury and discount options. Houses of worship were very prevalent in all of the areas and varied throughout, suggesting a very diverse community. Both Pascal Filsaime and Kathy Blodio were interviewed in order to gain a better understanding of the community from their perspectives. Filsaime is the Community Health Coordinator at the Long Island Collaborative and described Nassau County as a mini New York City due to the high congestion and traffic. She also stated that it is much more difficult to get around on foot in Nassau County than it is in New York City, as indicative by the observations of limited sidewalk use during the windshield survey. Color lines were expressed as a major concern because the socioeconomic status of the community can change from very affluent to poverty-stricken from one corner to the next. Blodio is the Safe Kids Coordinator of Nassau County, which is run by Northwell Health, and expressed very similar responses to Filsaime. She emphasized that the diversity of the community and stated that it's very busy, making it nearly impossible to navigate without a car. Both leaders addressed that heart disease is the greatest health threat to the community, despite the available resources to prevent it. Nassau County ranks second out of 62 communities for health outcomes in New York State. Heart disease is not only the leading cause of death among Nassau County, Suffolk counties, New York State, and the United States, but also worldwide. The rate of mortality due to heart disease in Nassau County is greater than Suffolk County, New York State, and the United States, with a rate of 283 deaths per 100,000 population. Cancer ranks second with the rate of 182 deaths per 100,000 population. Compared to Suffolk County, New York State, and the United States, Nassau County has the smallest percentages of obese persons and smokers, the greatest percentage of access to exercise opportunities, and the greatest percentage of people who consume 5 or more fruits and vegetables per day. With 10 being the best, the community has an overall food index of 9.7, indicating an overall high access to and proximity to healthy foods. However, Nassau County ranks 59th out of 62 counties for environmental health. The air contains elevated levels of particulate matter. There has been at least one community water system within the county that has received health-based violations in 2019. And of the total housing units in the county, 22% have at least one of the following severe housing problems: lack of complete kitchen facilities, lack of complete plumbing facilities, overcrowding, and/or severely high housing costs. There are countless assets, resources, and capabilities that exist within Nassau County that strengthen the community as a whole. Recreational areas are very prominent within the community and serve as opportunities for physical activity and educational experiences. The community contains more than 60 parks, preserves, and museums, with each park equipped with varying amenities including tennis, paddle ball, bocce ball, and basketball courts, grass and turf fields, bicycle and running paths, roller and ice rinks, playgrounds, horseshoe pits, golf courses, and swimming pools. There are 12 hospitals located throughout Nassau County, along with 9,437 licensed physicians of varying specialties. Northwell Health is the largest healthcare organization in the country, and its headquarters are located in Nassau County. Not only do they provide quality care, but they also host various educational and interactive events and classes for communities they serve to raise awareness and provide additional resources. Community-based organizations are another asset to the community. The Long Island Health Collaborative is a partnership of Long Island's hospitals, county health departments, health providers, community-based social and human service organizations, academic institutions, health plans, local governments, and business sectors that all work together to improve the health of Long Island communities. One of the programs that the collaborative hosts is the Walk with a Doc program, where a local doctor leads a short group health talk on a chosen topic and then walks with the group for the remainder of the hour. The Nassau Queens Performing Provider System began collaborating with local universities in Nassau County in 2018. They include Adelphi University, Hofstra University, Molloy College, and Nassau County Community College. And they pool their resources in order to address the issues in the community. They have been working together toward improving cardiovascular diseases via the Million Hearts Initiative, which provides programs and resources to help reduce and manage associated risk factors of cardiovascular disease, such as high blood pressure, and increase prevention behaviors such as physical activity. Guided by the first 4 phases of the Precede-Proceed model, the asset mapping process, and the various criteria of prioritizing health issues, including prevalence and incidence, potential for prevention and early intervention, and cost to the individual and the community, it was clear that the priority health issue in Nassau County is heart disease. Based on the risk factors associated with heart disease, including unhealthy diet, lack of physical activity, tobacco and alcohol use, high blood pressure, high cholesterol, diabetes, and obesity, and observations and data collected from the community, it is advised to address this issue by targeting modifiable risk factors. Increasing community engagement, providing incentives, and increasing awareness are the 3 strategies that are recommended. Community engagement can help build relationships, improve self-efficacy, and increase health benefits, just as the Walk with a Doc program does. Collaborations between insurers and workplaces can offer different incentives like money or discounted gym memberships for activities like completing educational courses, tracking regular health activities, and completing biometric health screenings. Increased awareness focusing on heart disease itself as well as the risk factors associated can aid in the prevention and early detection of heart disease. This concludes my presentation of the community assessment, and I thank you for listening.